If you're interested in a suggested morning rehabilitation program for your stroke survivor to carry out in their own home, then this video and chapter 19 of Lights, Mirrors, Action is going to discuss not just the type of therapies that we think would be suitable for your stroke survivor, but also just as important, the sequencing of therapies. So listen on for this particular program to be discussed. Hi there, my name is Dr. Kenneth Manan. I'm a university lecturer, I'm a neuroplasticity expert, and I'm the author of Lights, Mirrors, Action, a guide for transforming the lives of caregivers and stroke survivors. I'm also hugely passionate about trying to adapt and make a stroke survivor's home an ideal place for them to carry out their physical rehabilitation after they've had a stroke. Well, if your stroke survivor is going to carry out a program on a daily basis and try and achieve towards 2 to 3 hours of therapy, then sometimes it's very sensible that they have a suggested program to start with. Now, what's an important concept here is that Lights, Mirrors, Action for me is very much representative of the sequencing of exercises that your stroke survivor undertakes. So the timing or the sequencing and which therapies are done before which therapies has an impact, from my experience, on the ability for your stroke survivor to create more neuroplasticity in their bodies. So Lights for me very much stands for therapies that, wake or warm up the body and get the body going, get the blood flow in your body going. And so examples of walking and stretching are probably really good for this type of thing. So a little bit like sports, when in sports people are getting themselves ready for activity, they warm up and they kind of excite the body and they activate different parts of the body. Your stroke survivor probably needs to do the same thing as well. Mirrors in Lights, Mirrors, Action. Mirrors stands for the type of innovative therapies that we've discovered in our research lab over the last 12 years. And we're talking about therapies that excite the brain and kind of stimulate the brain and create an environment up there that allow for neuroplasticity to take place. So the type of therapies we'll be talking about is mirror therapy, sensory substitution effect, cross-education effect. These types of therapies are the ones that excite and create an environment that should allow for more neuroplasticity, more patterns to be created. And then action within Lights, Mirrors, Action. Action stands then for, once that your stroke survivor has that environment created, then they should be able to avail better of doing ordinary activities or tasks at home, ordinary techniques, ordinary activities of daily living. When they try those, we're hoping and we're expecting that they'll probably have more success creating these neural pathways. So the morning program that's described in chapter 19 discusses, first of all, the concept of expectation priming, which we've discussed in previous videos. So the idea that if we can prime your stroke survivor with very positive messages, so focusing on positive messages about the therapies that they're going to undertake, about the environment that they're in, about, having a positive mindset, about why we expect that there will be a successful outcome if they carry out the therapies in the way that's shown to them. So expectation priming will always be part of the morning and evening programs that I suggest. Walking, so our lights, our waking and walking, first therapy is going to be walking. And what I suggest is that for those who can walk, that we start and aim to do 2 to 3 minutes of walking, no matter how slow, no matter how many steps is taken. And we do this in an attempt to try and create an environment where we warm up the tissues in our body. I've discussed in chapters in Lights, Mirrors, Action the huge benefit of walking and the newly discovered benefits, which include the creation of brilliant growth factors in your body. And so you're creating an environment that's much better for neuroplasticity, and you're also warming up your tissues. You're changing the viscosity of your tissues, which makes them much more easy to stretch out and move potentially as the programs move on. I'm suggesting that after walking, the stretching of the shoulders, the elbow, the arm is undertaken. And in Lightsmer's action, we show a very simple stretching program, which suggests that stretches would be held statically for 30 seconds, where we just feel the very, very minimum of resistance, the very minimum of stretch is the concept that we want, and it's the principle of trying to get the best stretches. So stretching is done second, and then thirdly, representing the MERS phase of Lightsmer's action. In the morning time, I'm suggesting that we try our mirror therapy, which we've discussed before. So your stroke survivor is going to carry out mirror therapy exercises for 10-15 minutes, as is shown in the program. Once the mirror therapy is over, then we're going to take a break, and that's our morning program finished. So the main message coming through from this is that the sequencing of therapies, sequencing of these safe therapies that's recommended to you in Lightsmer's action is very much thought out, so that each therapy adds and gives a chance for your stroke survivor to have the best ability to recover and create neuroplasticity in their bodies. So I wish you a very best of luck trying this program, and you follow along with the chapter 19, which shows you the therapy and gives you a rough guideline of how many minutes and how many repetitions, etc., to try and carry out to start. And if you want some more resources, some more worksheets or some more workbooks, some more YouTube videos that describe and show how to do some of these therapies, then please go to my website, which is www.lightsmirrorsaction.com. And there you'll find extra videos that back up chapter 19 of Lightsmer's action. Thank you very much for listening, and very best of luck with this morning program with your stroke survivor. I know that it's going to be hugely beneficial, especially when it's done at home. Thank you very much.